What's the difference between traditional and modern braces? A scoliosis brace is a type of back brace that's designed to really limit spinal motion. And we know scoliosis is a progressive condition, so it's very nature to worsen over time. And this is particularly important for adolescents that are going through growth spurts. And bracing is typically thought to help keep the spine in a more aligned position during this rapidly growth phase. And there's two different types of scoliosis braces. Just like there's different types of scoliosis approaches, there's different types of braces for patients to choose between when they're choosing the type of approach they want to use to help manage and treat their scoliosis. Traditional scoliosis bracing complements traditional scoliosis treatment. And traditional scoliosis treatment, typically the goal is just trying to slow down progression using bracing and try to prevent surgical intervention. And if it becomes severe enough, that's when they recommend surgery. Where modern scoliosis bracing, the goal is really in correcting and reducing the scoliosis during this growth phase so the patient can end with the smallest possible curve. And this complements a modern, proactive, conservative treatment model that's actually the goal is curve reduction. What's mostly commonly used in traditional bracing is something called a Boston brace. And a Boston brace has many shortfalls. And the Boston brace was designed in the 70s, and the goal was really just trying to slow down progression during growth phase. And very little has changed in the design of the Boston brace since this time. And despite the growing understanding of scoliosis and better design manufacturing optimizations that can occur with bracing, the brace is still pretty much the same. They say it's a customized brace, but it's really not that customized. I have patients that have different types of curves in different locations. If they're roughly the same size, they can switch their Boston braces and it's almost the same effectiveness. But these are really just designed to help try to squeeze the body and try to stop the curve progressing. These braces tend to be bulky and uncomfortable, and compliance can become issues because normally the patient worsens wearing Boston braces, and therefore it creates more pressure. The brace becomes more difficult to wear, which can be harder for the patient to comply. The bottom line is Boston braces works on a very simple 3-point pressure system, one push with 2 counters. And this system just applies pressure to the spine by squeezing it. And squeezing can weaken the spine over time. But the bottom line is that it ignores the 3-dimensional rotational component that's associated with scoliosis. And this limited squeezing really limits the potential effectiveness of Boston braces. And therefore, no brace can be effective if it's not addressing all the components. And because of the compliance issues, we know bracing is only effective when it's worn. So if a person can't prescribe with bracing properly because if it's being uncomfortable as the curve worsens, we know that the likelihood of being successful with bracing rapidly decreases. Boston braces can be prescribed up to 23 hours a day, which is full-time bracing. And this is normally done through the entire growth phase of the child, which can be anywhere from 2, 3, 4, even up to 5 years. Now, modern bracing, like a corrective style brace, like a ScoliBrace, is something that we call ultra corrective. And the reason why we call it ultra corrective is because it represents the culmination of what we learned about scoliosis and brace effectiveness over the years. And the goal of these braces are not just trying to squeeze and slow down the progression with a 3-point pressure system. The ScoliBrace is actually 100% customized person to person. No 2 braces ever look the same, and they're designed in a biomechanical way to not only push the spine into a straighter position, but also have the body react into a straighter position using biomechanical principles of spinal movement. And we know that each brace, since it's customized per person, it is as comfortable and as less bulky as it can possibly become. And since the brace is applying corrective forces, the brace tends to get easier to wear as the person improves. This tends to lead to much better compliance. So therefore, we know the ScoliBrace, the compliance can be better, so therefore it can deliver a better result. We also know this corrective brace addresses the spine's or the scoliosis rotational component, which is treating it as a 3-dimensional problem, unlike a Boston brace. And since it's pushing, it can actually create a corrective force that can be part of an entire conservative treatment program that works in preserving spinal integrity and keeping the spine healthy and strong, as opposed to just hopefully it doesn't progress to surgical standards. And the key part of the ScoliBrace or a corrective brace is how it integrates in other types of treatments in a positive manner. When we look at how treatments combine, traditionally, when we look at traditional treatment options, they're normally reacting as opposed to being proactive, meaning there's not much done to do to keep curves small if they are small. And it's only when they worsen is when they try to increase their treatment methods, meaning curves less than 25 degrees. They're normally recommending nothing. It's not until they break that 25 to 30 degree range is when they're typically recommending bracing. And normally the recommendation stops around 40. So you have this very small window between 25 and 40 degrees that they would recommend a brace. And then when they apply the brace, they're just hoping that it doesn't worsen during this stage. If it does worsen, there's really nothing else they really do. They don't have a different brace design or new options to offer you. They just say, okay, now it's severe. Now we're wrecking spinal fusion. And even if it doesn't progress, there's nothing that they're doing to try to even make it better. They're just hoping it doesn't happen. So it's really just like, let's just throw a brace at it and see if it stops. And of course, we know spinal fusion is a very costly, it's a very lengthy, it's a very invasive procedure that can affect the spine and its overall health really for the rest of that person's life. So it's a serious procedure that needs to be taken all the considerations of the long-term effects need to be really taken before you make that decision. When we look at modern treatment, especially associated with conservative corrective bracing, the goal is really at preventing as much progression as possible, but we try to prevent the progression by actually reducing the curve into a more milder version of the scoliosis. So no matter what the curve size, whether it be 20, 30, 40, 50, 60. The goal is to make the curve smaller. And as we make the curve smaller, we want to continue to make the curve smaller. It's kind of like if you look at braces on your teeth. Nobody would put braces on their teeth if the goal was just to slow down how much the teeth were worsening. People put braces on their teeth to make their teeth straighter when they're done. And that's the goal of our type of treatment, is to actually reduce the curve during the critical phases of development. And even in older patients, the goal is to make it smaller. And as we can make the curve smaller, we know we're reducing the impact the scoliosis is having on the body. And if we can reduce the impact and make the curve smaller while preserving spinal health, meaning not fusing with rods and screws, we're definitely getting the best of both worlds. Conservative treatment model typically combines multiple scoliosis-specific treatment disciplines into the program. We can use chiropractic care, which is typically combining instrument and manual adjustments to help reduce the scoliosis and improve the mobilization of different areas of the spine and removing nerve pressure. We can use physical therapy to increase core strength. We can use corrective bracing to augment these exercises. We can use customized in-office rehabilitation, which are scoliosis-specific equipment to help push the scoliosis into a straighter position. There are many different therapies in rehabilitation, and it's this multimodal approach that is organized in a way that everything complements everything else. Is what delivers the very best results. And the last thing is the way the spine is managed. If I were to sum up, is that traditional types of treatment really are just trying to slow the curve down and hope it doesn't become more severe. So they're just trying to slow the worsening. When we look at modern conservative corrective treatment, the goal is managing a reduction. So we're trying to reduce the curve, stabilize it, reduce it, the curve, and stabilize it, and trying to end where the curve is as small as possible. And we know that if a person goes into the adult form with a smaller curve, they have a better prognosis for the rest of their life. So when we look at scoliosis treatment, you have to make a decision on what type of treatment that you want, because where you start is going to be where you end. Meaning if you choose a more traditional manner, you're normally not going to get reduction in your scoliosis. You're just trying to slow it down and hope you don't have surgery. If you choose a corrective approach, a more modern approach using corrective bracing, then the goal is to try to reduce the curve as much as possible and end in the adult form with the very smallest possible curve. These are very different treatment goals, very treatment mindsets, and as a result, it's going to be very different types of treatment applied to the patient to achieve each and every result. Here at Scoliosis Reduction Center, we're a big proponent of corrective style treatment, and that is what we typically recommend. Thanks for watching. I hope you found this information helpful. If you'd like to hear about other topics and information on scoliosis, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish content. Thanks.